honored to have Madison Hayes here from Ball State University, and she's here to present a poster for her master's thesis. And she's an RDN, which is a registered dietitian nutritionist, just recently graduated from Ball State. So maybe, Madison, just start with, you know, people are confused by all the letters people have behind their names. You know, the RD, RN, what's a dietitian, what's a nutritionist. Just give us a little background on the career fields now that are helping people in the space of nutrition.
Sure. So a registered dietitian or a registered dietitian nutritionist, those two are pretty much interchangeable. They have added nutritionist to the end of registered dietitian recently, I think just to kind of help with the confusion behind what's a dietitian, what's a nutritionist. So in other states, I think you can be a certified nutritionist, but most places you go, especially if you're getting referred by a doctor and it's going to be covered by insurance, you're going to see a registered dietitian or registered dietitian nutritionist.
Now, is this training you do after undergrad, or do you incorporate this into your college studies?
So it's after undergrad. So a registered dietitian has a 4-year degree and then at least a 1,200-hour internship, and you sit for the national registration exam. Most of us now have a master's degree also, because in the next, I think, 2 years or so, that's going to be required. So like for my program, the internship was coordinated with the master's program. So
that's intense training. You have 4 years after your college of additional training.
So, well, the 4-year bachelor's degree and then 1,200-hour internship in addition to that. Then you sit for the national exam. Yes.
And your internship years, we work with RDs a lot in my hospital. How much of it is it kind of that intense hospital management, TPN, you know, that whole technical side versus the clinic, the real world, diabetes, obesity? How much of a split is that? So
it depends on the program that you are a part of and what the focus is. So they all have, and I can't remember off the top of my head, but they all have a certain amount of weeks of training in, you know, in the hospital setting, and you're going to rotate through renal, through cardiac, through the TPN, you know, all of that kind of stuff. And then, and mine was an M&T focus, so I got a few extra weeks in clinical training, but you can also have a focus in like community nutrition where you get a few extra weeks in maybe like a WIC setting, something like that. And then you also do food service, so you learn that side of it. And some dietitians want to work in hospital food service, or school food service. So it just depends kind of on the focus of the internship. But we all have at least a basic rotation.
What brought you into the field? Like, what's your backstory, Madison, to make you get interested in this as a career?
That's a good question. So I've always been interested in medicine in some way, and nutrition. I think that kind of came around probably more like when I was in high school and I started realizing that food really could be medicine. And so that's where I got interested in nutrition in general. And then the low carb side of things is relatively new for me, since that's not really part of your standard dietitian training. So that's kind of, I've sort of come to that on my own. So that's, yeah, where that came from.
You're presenting a poster here that's part of your master's thesis. So tell us what you've shared with the group here at Low Carb Denver. And you must have a passion for being here, because we're in the middle of a corona scare. And so the people that are here really want to be here. And for people watching, we're taking all the usual precautions that you would take in any place to limit exposure and people that might be sick. But tell us about what you're sharing with the group here about your research or your clinical work for your master.
So I am presenting a poster with the findings of my master's thesis. So part of when I got interested in low carb and all of that, I started, you can't really avoid hearing about it, right? It's everywhere. And learning about nutrition, studying nutrition. I was in grad school at the time, and I started thinking, well, I'm not learning about this in school at all. It's like the hottest nutrition topic around. Everybody I know, I wasn't practicing at the time, but everybody I know, every family member, every friend, you know, everywhere you go, people are asking about it. But I wasn't learning about it in school, and I'm supposed to be, you know, trained to be a nutrition expert. So that kind of sparked the idea for me, well, is it just my program? Are other dietitians learning about it? Is it, you know, something that's just not being included in my program? So that was, I took that idea and ran with it for my thesis project. So I surveyed dietitians that were part of the Indiana Academy of Nutrition and Dietetics and asked them a bunch of different questions about, do you use keto diets? I'm specifically interested in diabetes, type 2 diabetes. So I asked, do you use keto diets to treat type 2 diabetes? Have you ever used them? What are your attitudes and beliefs about them? Because I definitely was picking up on the fact that there's a lot of bias among dietitians. And so I wanted to know how widespread that was and how that's affecting their dietary recommendations. So that's kind of what I presented in my poster, were the findings of that study, so to speak.
Yeah, that took time. So you're just contacting people by phone or by email, or had a survey monkey, or how did you get together that data?
So I created the survey first through Qualtrics, which is similar to SurveyMonkey, and then through contacts at the Indiana Academy of Nutrition and Dietetics, they sent it out in a mass email to all the dietitians that are in the Academy in Indiana. So that's sort of how I got my population base.
And then your findings. You know, how did it turn out? Like, what did you see from that, and was it surprising? Anything surprising, Madison?
Unfortunately, not surprising.
Not surprising that they're all teaching keto, or not surprising that none of them are teaching?
So, not surprising that none of them are teaching keto. They're not teaching it. They overall have never recommended it. The majority said that they don't believe they ever will recommend it, which that's the most concerning to me, I think, because how do you make your mind up?
Critically think, you know, and so, yeah, that's I mean, it's again not surprising, but somewhat disappointing.
Yes,
it must be for you going into the field that none of us know what's right or wrong, but we all know none of us know the truth yet, and we're open to things that have scientific validity, that are working and helping thousands of people. So we need to So yeah, what percent of RDs? These are practicing RDs. What percent have actually used low carb or ketogenic diets for type 2?
So of the 199 dietitians I surveyed, 93% said they never have.
93%, and I saw your poster on there. And how many they never have? Is that just because they don't know how to do it, or do you believe, or from what you found, that's they never have because they don't think this is safe?
So I think it's a combination.
I've never done brain surgery.
Yeah.
I think it's a good thing, but I wouldn't do it.
Right. I'm not qualified for that.
You know.
So I think it's a combination of things. That's why I went at it from the attitudes and beliefs side of things, because I do think a huge part of it is lack of education. In my formal training, I learned about keto diets, a small blip about, we use this for epilepsy. It's dangerous. We do it inpatient. We have to really closely monitor all of these things.
Monitor all those eggs.
And you know, stuff. Watch the blood sugar and all that. So, like I said, I wanted to know, are they being taught that too? So I think that's definitely a huge part of it, is that they don't understand it.
They don't understand.
But there's certainly the attitudes and beliefs piece of it. So I asked, do you think you'd be judged negatively by your peers or colleagues? The majority said yes. Yeah. What would prevent them? So workplace standard of care was one. And then all of the common misconceptions about cardiovascular concerns, renal concerns, hypoglycemia, all of these things, again, that go back to just being educated about how to use it effectively in a patient with diabetes. Yeah, big combination of things, I think.
So your future, you're going to go out and start working, so you must have some mission now to at least educate, but what do you see yourself doing now in this space? Do you have some allies in you? Feel like of the 93% said no, but I'm a glass half full. You got 7% here. You got 14 people that said, look, I'm in.
Yeah, really.
Right?
So unfortunately, in my day-to-day life, I do not know any other practicing low-carb dietitians.
Come talk to us in West Virginia.
Yeah, I would love to. I am actually practicing, and I utilize low-carb diets to the best of my ability in the space that I'm in, surrounded by maybe not the most open-minded. Some of the practitioners I work with are, not all of them are.
So you're having doctors refer to you, and if you were just, in your community now, if you had a patient with a hemoglobin A1C of 13 on 200 units of insulin, sulfonylureas, all this stuff, and they want you to give some nutrition advice, and you recommend a low-carb diet and med reduction, because they would have to, what would be the response of your treating clinician? Would they say, man, that's an awesome idea, let's do it, or would it be the opposite? Like, I don't think that's a good idea.
I'm still a bit constrained in that way. I pick and choose which patients I use real carb restriction with, and typically I stick to those that are on the meds that it's safe to use a very low carb diet with. I'm still working to find a practitioner that can be an ally with me as far as med reduction. I have gotten a couple of nurse practitioners on board, so that's a goal.
Yeah, we wrote the guideline that you can take back that goes through the med reduction.
Yes, yes. So I don't prescribe, but I know well enough to know, okay, SGLT2s and insulin and things like that you have to be careful with. So the majority of the patients that I put on what I would consider a true keto diet are metformin treated, or metabolic syndrome, pre-diabetic, yes, whatever you call it, it's all kind of the same.
The only downside of a low-carb diet is if they're on too many medications.
Right,
yeah, they're going to have, it's not
that's the only danger.
It's not the diet's dangerous.
Yes,
the
the diet is
improves
effective.
Enough that the medications are no longer needed, and the medications
are too strong at that point.
Have you been to any of your national meetings, for RD nutritionists? At the national level now, if you go to the meetings, a colleague came back from one of the national RD meetings, and the most attended session that brought up the most heat and controversy, which I think is a good thing. Who said, like, when the flak is the greatest, you're over the right target, is an old military saying. But, so maybe that's happening, but are you seeing that in some of either regional or national meetings? So there'll be a session on low carb, and that's creating some talk.
It's definitely becoming more of a hot button issue. I haven't been to a national one yet, simply because I was a poor college student. And I could, I have submitted it for the next national conference that's actually in Indiana next year, which Dr. Westman was at the last one, and my mentor, who helped me with writing my thesis, who was very anti-keto to start with, was very excited to see that he was there and was like, oh my gosh, there's a keto guy here.
He's written 100, 200 papers.
Yeah, so he's an amazing resource. So it's definitely becoming more of an interest. Yeah, there are some speakers here and there. There was one at the Indiana conference. She was speaking on keto and epilepsy, but still there was a huge crowd. So I think the dietitians are interested. They want to know. They know that it makes us all look bad.
To know, because if the most, I don't like the word popular diet, the most common lifestyle change people are making now for their health is low carb, and if you just need to understand it. People in your field, like, it's not about agreeing or disagreeing with religion, like believing. It's just
you have to have the knowledge if you want to be.
2020 ADA guidelines for diabetes, low carb. You have to teach, and your colleagues have to teach whatever the patient wants to do. You're going to work with them. So we're really proud of your courage.
Well, thank
you,
really,
Madison, for coming out. That it's harder when you're younger to go against, the eminence, the people that have been in your to challenge your professors is not encouraged in education. We're graded on being right and wrong, which is really discouraging also, because if you're wrong, you'll never question anything if you think you're wrong. And the words we should be encouraged to be wrong.
Especially in nutrition.
Because we've been all wrong. The world is getting fatter.
Yes. Exactly. So something's definitely going wrong. So
and, you're gonna change, keep being disruptive and go change the world.
Well, thank you.
And tell us, do you have any patients that you've done this with that, okay, you can read all the damn textbooks, but like this is right in front of you. So have you had any personal success stories, using low carb for obesity, diabetes, any other condition?
So I have a few patients. I haven't been practicing long, like I said, but I do have a few. I have one amazing standout patient who had not actually been diagnosed with diabetes. Her A1C was almost 7, though.
Okay, that's
I
diabetes.
think, yeah, I
That
think
fits the criteria.
it wasn't in her chart, but I think the doctor was kind of dragging his feet, like, you better make some lifestyle changes. And so she came to me. She was kind of one of the chronic dieters, had done so many different things and never really had success. And I said, okay, let's try this. Within 3 months, the last time I saw her, her A1C was 5.3.
Nice.
And she's dropped like 40
No
pounds.
medications.
No
just
medications.
So
No
that's a
medications.
remission.
Yeah.
40 pounds off.
So that's extremely encouraging.
But like the most important thing is, is what if she had just stopped eating for 3 months and starving herself and felt miserable, the numbers might look the same. But how is she doing? Like, what is she doing?
Right.
And is this something that's making her feel good that she can sustain?
Yes. Well, so she loves to send me her progress pictures, and her
meals. Does she send you like what she had for dinner?
Yeah. Well, they love to do that, and I like to use it I put it together to show the doctors, like, look, it's not all steak and eggs, guys. These are healthy meals. This is what they look like.
Seafood.
Yeah. Her husband is extremely happy because she's not snoring anymore. She's sleeping very well. She's finally starting to exercise. She actually works at a gym as an HR person, but has finally decided to start exercising. So yeah, she's doing extremely well.
Yeah, that should not be the exception.
Yes.
That should be the expected, treatment and the expected result.
Right.
And,
I think the doctors are amazed
support,
sometimes.
without you being there to support her, if you told her this was all hogwash and she was bread addicted. The doc said this, I'm losing weight, my sugars are better, but my doc and my nutritionist says it's not sustainable.
Yeah,
that bread is an essential ingredient for you.
Right. That's
just like, essential fatty acids, essential bready acids or something.
I love to use that with my patients. I tell them, if you're not going to get a vitamin deficiency if you stop eating bread, okay?
There's no essential bread.
Yes. People have been going without bread a long time.
Well, good luck getting into the national conference. And it'll be in 10 years from now. What would be awesome is if we're both sitting here and you have a follow-up poster and the pie charts have changed.
Flipped completely.
Support for the right patient, a low-carb diet.
Yeah.
100%.
Yes.
Because it works.
That's the goal, exactly.
How many of y'all think it's dangerous? 0%?
Yes. I'm going to try to change the hearts and minds.
They might withdraw.
Yeah, by then we'll know. Yeah. So hopefully.
Well, great.
That'll be great. Yeah.
Nice to
meet you officially.
All right, Madison.